Okay, so this is my IV starter video. So it's almost the same as drawing blood, but a little bit different. So when you start off, you obviously want to gather your supplies. So you need your IV start kit, which mine is open, your extension set, some saline flush, and then your catheter, and then some clean gloves. So again, I'm gonna use my husband's arm, and then I'm gonna actually stick the box. So when you walk in, you want to obviously introduce yourself, perform hand hygiene, and then ask for 2 patient identifiers. So ask patient to state and name their date of birth while checking their wristband. IVs, people tend to really hate them, so you need to explain why they need them and the importance of them. And then when drawing blood, I like to ask the patient which arm they like, and I think it's the same with IVs. Like, a lot of people, especially if they get a lot of IVs, will tell you where they want their IV. So the worst place to put an IV is your AC region, just because there's a bend in your arm, but some patients really like that. But then you can also stick their arm and also their hand, which is like all those dorsal venous networks. So I like the hand, so that's what we're going to use today. So when you're doing this, you'll go ahead and perform your hand hygiene, and then put your gloves on. And a good thing to do before you do anything is to go ahead and just connect your extension to your saline flush. So you'll want to pull this out, and you'll go ahead and pop this off, and then you'll take this off as well. And it has a bubble in it, so you're going to want to prime that and get the bubble out. So a little of the fluid will come out, and then you'll go ahead and do this. And then you can also prime it as well, just because there's air in here. So again, you would push the fluid up until a little bit came out of the end. But you want to keep this sterile, so you're going to go ahead and put it back into the packaging. Okay, so then you want to go ahead and you want to find your vein. So in the other video, I didn't realize this kit had a tourniquet. So in putting on a tourniquet, you would go ahead and say you were going to do the AC region for an IV stick. You would just kind of do it tight, and then you're going to leave it in that easy fold so that you can just pop it off, so it makes an easy pop. For the arms, if you were going for any of these veins in here, again, you would just want to go a little bit above and do that easy tie. For the hands, because they're so superficial, you usually don't need a tourniquet to see these veins, but this is the dorsal venous network, and they're easy to roll, so you'll always, instead of anchoring like you would doing a blood draw, you would just ask the patient to put a fist, and it kind of like holds those veins so that they don't roll anymore. You could always anchor, but again, they're very rolly. So you would go ahead and inside your kit, you have a couple of things. So you have the tape, you have some gauze, and then you have the cleaning solution. So you could always pull off a piece of tape and put it aside so that you can have that ready when you need it. And then in order to activate this, you would just push down on it. And so once you push down on it, you would clean, again, in a circular motion for about 15 to 30 seconds. And then you would go ahead and let that dry. So then you would go ahead and you would get your catheter. So you would open up your catheter, and then you would pull this out. Again, you need to have the bevel up, and so you would have the patient form their hand in a ball so that the veins wouldn't move, and then you would go ahead and advance your needle in, and then once it's in, you'll be able to see some blood, and that's how you know that your needle is in the vein. Then you would want to go ahead and advance your cannula, which is this pink part, And so you're advancing the cannula, and your needle should come out. And then you'll go ahead and safety that needle once it's out. And it goes in. So at safety, you would put this in the sharps container. Immediately, you want to go ahead and put pressure above that cannula because blood will spray out everywhere. And then you want to go ahead and put your extension tubing on. So you would pop that off and then screw it on, which is a lot easier said than done. And then once that is on, you would want to go ahead and push your saline in. So when you do this, you're looking for it to like bubble up around, and that means that you've transfixed the vein and you're not in the vein anymore. So then you would want to go ahead and pull that out and restart your whole entire IV. So that's not a good sign. Good signs are like if the patient can feel it, it's cold, if they can taste or smell it, that means that you're in the vein. So that's actually a good thing. So you would go ahead and you would push your saline in, and then you would want to, so that no blood gets in, you would, I can't redo this, you would clamp it, so just like that, so that blood doesn't advance in the tube. And then you would go ahead and remove your saline flush. So it's clamped so that none of the blood can come out of this. And then you would go ahead and use your tape, and you would tape this down.